And I can see. Everybody.
Always.
Yeah.
All right, we are live recording and up on YouTube.
Okay, everybody is settled. I would like to call the Wednesday, June 5th, 2025, safety and licensing committee to order. First order would be a roll call.
Here.
Alder Wagner,
Present.
Alder Kelly,
Here.
Alder Pabon,
Alders, Pete and Frazier will be listed as excused. Next item will be the approval of minutes from the June 11th, 2025 meeting.
Motion for approval minutes from June 11th.
Second.
We have a motion, second, any corrections, additions? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion passes. First item, will be read by the clerk.
new massage establishment application for Matthews Jing King DBA Relax 17 located at 3417 Douglas Avenue. Matthews Jing King Agent 15 District.
Do we have a Matthew James present? If not, can we have a motion to move this to the end of the agenda?
Okay. We don't need a motion.
You can do it as chair.
Oh, I can? Hey, I'll just move this to the end of the agenda. All right, next item, please.
Item 0620-25, a new massage establishment application for We Win Zoo DBA Lucky We Win Zoo Therapy located at 906 State Street, We Win Zoo Agent First District.
Do we? It looks like we have someone here. Yeah, oh, absolutely.
Here.
What is your name, please? Okay, we just moved your item, but if you want to have a seat, we'll take it up.
Thank you.
Okay. Okay, so do we have? We Zoo present?
That might-
I think we're probably hard to find. So it looks like we have someone coming in. Hello, come on in. Can I get your name, please?
Oh, where's Reynolds?
Oh, you're all together, okay. You're not we. So we is not present. I'll move that item to the end of the agenda. We'll go back to the first item, which was the Matthews Young Queen D. Relax 17 located at 3417. Okay, and we do have the applicant here. Could Jean Queen? Can you come up and do you speak English?
No, she don't.
Is there someone here to speak for you? Okay. All right. So can you tell us about what your intention is at this establishment?
Just buying over the Relax 17 massage parlor, so. She's buying over the shop
Is buying it?
and. The Relax
If we
17,
can let them sign in, or sorry, sworn in,
Sworn in.
yes.
Good luck.
If you can raise your right hand. Both of you will do it.
same,
Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
yes.
And then you can translate for her so she knows what she agreed to.
Yes.
Thank you. And then if you could also state your,
My name is Paul Saint-Lo, I'm just a translator for that.
Good.
Yeah.
Okay. Well, looking over your application, is it that you don't speak English, that you have some issues with filling out the application? So for example, it asks you to print your name, all we have here is an NJ.
Did she write her name right now? Maybe she misunderstood what the question was, yeah,
It says print me.
yeah, but can she do it right now?
Well, no, the application's already been submitted, so we can't make changes to the application once it's been submitted. Okay, so, and you live in Evansville, Indiana,
So that, Indiana,
or Illinois?
Indiana. Evansville, Indiana. Oh, her address is in Illinois, yeah. Evansville, Illinois.
And have you done this kind of work before?
Yes,
Is that what you did in Evanstonville, Indiana?
she do, yes,
Did she work there or did she own
she works there.
what's
She,
there?
yeah, she works in a massage,
But,
she doesn't own the place.
okay, would you intend to have employees?
That's it. Yes, yes.
How many employees?
Yeah, but two. Yeah.
And what will your hours of operation be?
Oh, yes. It's 9 AM to 9 PM.
Are there any questions from the committee members? Or is there any issues of concern coming from the police department or the city attorney's office?
Yes, so the Racine County Sheriff's Office has a individual who is trained in identifying illicit massage businesses. I have requested him to review any applications we receive for massage businesses, both to see if we should approve them or deny them. And it came back with connections to previous illicit massage businesses that were advertising on websites for sexual services.
But she doesn't know anything of what's happening before. She's only just buying the shop at the moment.
The sheriff's department found, the sheriff's office, I should say, also found connections at the Evansville, Indiana address on the application. And then the name of the massage therapist and the addresses associated with that name as well.
But she's not in that list, is she?
So I believe that she does not have a specific association with her name, but the name that came back to some of these addresses was a similar name, not Matthews Jean King, but Jean King Ding.
Yes.
Yeah.
So you mean, was she involved before or?
So the sheriff's office has found listings that indicate that the addresses and the names had involvement with these advertisements online for illicit massage businesses.
Maybe let me tell you. We say so. Maybe you'll find out. She said no, she doesn't have anything to do with that.
Okay. Okay, any questions for the attorney's office or for the police department regarding this application?
No,
If there are none, I would entertain a motion to either grant or to deny.
motion to deny.
Second.
We have a motion and a second to deny the application. Any discussion on that motion?
I just think we need more, a lot of stuff here, more clarification, more application for allow. Especially with the sheriff's reports, I mean, from.
Yeah, I just want to know from the clerk's office what denial of this application will mean for the applicants.
Actually, I would pass that on to the attorney's office. I don't know if there's a waiting period before they can reapply.
Let me double check. I know that if, the committee is seeking more information either from the applicant, the sheriff's office, my office, or some other body. A motion to defer would be in order. But also let me see what the. What a denial of a license would. It is typically a 1 year or a 1 year waiting period to reapply for licenses. I'm just checking to see if that. Also applies to massage licenses.
So I believe we need to list the rationale for motion to deny the license. Would we be able to articulate that?
Well, I spoke with the investigator listed on this report, and I take very seriously anytime there's commercial or human trafficking of individuals. So that to me is just the grounds for denial right there.
Do we have any further discussion on denial of the application? So then we'll have a vote. All those in favor of denial, say aye.
Aye.
Opposed? Motion passes. I'm sorry, but your license has been.
So, can she bring up fly or? Is that,
The attorney's office is checked to see what time frame she would have in order to reapply.
Yes, so there is a, you will receive in the mail the notice that the application was denied. You'll have 15 days to appeal that notice. And let's see here. And I'm not seeing that there is a specific time period for which that you are prohibited from reapplying. And so I would say, at least from my quick read of the ordinances, that there may not be a time period in which you are prohibited from reapplying. I will say it's a kind of a practical matter. If you were to reapply tomorrow, we would review the application again. Some of the issues may be cured, some of them may not be. But I don't know if there is a time period at this time. I don't see it in the ordinances, so I'm going to say no as an initial matter. But that doesn't mean that it's not in there.
Okay. So the denial is a recommendation from this committee. It will go to the full council for a vote next Tuesday. So this is simply a recommendation to deny. The denial will either withstand or be overturned at the council meeting next Tuesday.
okay. Thank you very much.
Thank you. Okay, thank you.
Can we leave?
You can, absolutely.
Thank you
can.
very much.
Thank you. Next item, please.
Item 0556 25, the appearance of Mark Spang for a new operator's license.
We have Mark Spain here. Seeing that he is not, has the course office heard from Mark Spain?
Yes, we have. He did let us know that he would not be appearing and doesn't want to get the license anymore, but we don't have anything in writing from him formally withdrawing either. But he has announced he won't be coming.
Okay, so this is the second time that he's been invited in and not shown, so what is the pleasure of the committee?
Motion to deny.
Second.
We have a motion and a second to deny the operator's license. Any discussion on that motion? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion passes.
Item 0555 25, the appearance of Elijah Simmons for a new operator's license.
Okay, and we do have Elijah here. Come on up, and I think you will be sworn in first.
Please raise your right hand. You swear or affirm to tell the truth, the whole truth, and nothing but the truth?
Yeah.
Thank you. And if you could state your name.
Elijah Simmons.
Okay, well, thank you for appearing. We're not gonna go into detail as to why.
Yes, can we? Because, yes, cause I got that in the mail saying that, it got denied because of all the charges I have.
Yes.
And it started from 1997, but I was born in 2003, so I don't know how those charges are mine. I'm not a felon at all.
Oh,
Oh,
But this wasn't on the felony.
It was from that, disorderly conduct.
Well, yes and no. It's for it providing a materially false statement on your application, because on your application, you did state that there was no pending charges against you, and I raised the pending disorderly conduct.
I asked the lady, because I said I have board still, and she said, well, if it's not a charge that's like on your records, I shouldn't put it down, but. If
Do you
that's,
know who
no,
the lady was that said that?
I was at the town hall, I think it was.
City Hall? The
City
clerk's
Hall.
office?
But other than that,
Okay.
well, the paperwork is a bunch of.
Okay. That you didn't have. Okay. So because a charge is pending, I don't know that we would have any documents for rehabilitation because.
That's
it's still.
for it's still on August 12th. I think for around this.
August 12th, there's a status conference for it.
Yeah, that's my last meeting.
Okay, I see a rough piece of paper with this little bell about.
That was the
Oh,
I
that's all
got
that-
that for today.
Okay.
Yeah.
Okay, so where are you gonna work?
Well, I was gonna work at Russell's Tap over there, but that didn't really work out. The owner was the next person.
Do you still intend to bartend somewhere?
Somewhere else, yeah, but I don't know where.
Okay. Well, do we have any questions from the committee members? We have something from the attorney's office.
Yeah, I just want to clarify what we are looking at here. So it's not the fact that there is a pending charge, it is that omission from the application that is at issue.
Well, I can tell you this is not the first time that operator applicant has told us that they were giving wrong information while filling out an application. So I'm gonna take this gentleman at his word. He did swear to you that he would be telling the truth, so I'm gonna believe that that is a possibility. So, but I still leave it to the discretion of the committee as to whether they wish to grant the operator's license or they.
I have a question for the attorney. So what was there's one charge, or I guess I was confused by the initial statement when that was made.
So initially, it was because he omitted something from his application, and that would be that pending charge
Okay,
or disorderly conduct.
and what was the time on that one?
The day of the disorderly conduct,
Yeah,
it was New Year's of this year.
You want to tell us about that? No?
It was being a little too loud and belligerent and too much alcohol, and there's just a lot of stuff going on
Happened at somebody's house or out on
outside,
outside,
right by the police station.
or right by the
So,
police station?
yeah, like-
You wanna make it easy on them, huh?
Yeah, all right. Yeah, that was really, it was just a bad night.
I will note that the charge itself, were it were to be disclosed, would not fall under guideline 1 as a disqualifying charge.
Thank you for that.
what I needed to know.
Do we have any other questions, or do we have a motion in regards to this young man's operator license?
Are you currently employed?
Yeah.
Okay.
So this is just the bartender's
Correct.
Yeah.
license.
Attorney's license, yeah.
Mm.
Well, I would make a motion to grant the operator's license.
Seeing as how even if he was convicted, it wouldn't fall under disqualifying anyway. I would agree with that. I'll make a motion to approve.
Second,
We have a motion and a second. Any discussion on that motion? All those in favor say aye.
Aye.
Both. Motion passes. So now the clerk's office will tell you what you can do.
You can give us a call and let you know where you're from. I don't have it here.
I don't know what you guys.
So this will have to pass council, correct?
The operators, yeah,
Yeah.
they're coming.
So it'll pass, it'll go to council next Tuesday. After next Tuesday, you call the clerk's office 636-9171,
The one that's on the paper probably, I think.
probably, yep, and then you should be able to pick up your license, operator's license. And then you're free as a bird to go.
All right, thank you.
After council will automatically mail it out, so I mean, if you need it quicker, you can come and pick it up, just give it a call, but otherwise council happens next week and we'll automatically mail it within that.
All right, well, thank you guys.
Thank you.
Love day.
Thanks for coming. Did you say love you?
No, I said you'll have a good.
Oh.
that'd be a new meeting.
The turn.
Okay, next item, please.
Item 0623 25 the appearance of Courtney Marshall, agent for 20 Grand Lux LLC. DBA 20 Grand Lux located at 1307 Douglas Avenue, pursuant to a formal expression of concern and also requesting consideration of rescinding the formal expression of concerns.
Okay, thank you, and do we need a swearing in?
Yes, you could raise your right hand. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
Yes,
And if you could state your name,
Courtney Marshall.
thank you.
Neither the attorney's office or the police department can remind the committee as to why we requested the presence of Mr. Marshall.
Sure, I can at least take the procedural and I'll let the police department handle the actual reports. So this is a formal expression of concern. If you are issued 2 of these within a 6-month period, your license could be referred to or will be referred to the city attorney's office for disciplinary proceedings, including a possible suspension and or revocation of your license. It's a 3-strike system. It's 2 within a 6-month period or 3 in a 1-year period. You will have an opportunity to address the committee to tell how you intend to correct the issues going forward. You do not have to discuss specific incidents unless you wish to do so. And that is the procedure on this. So you already had a received and filed formal expression of concern within that 6-month period. So if this one were to be received and filed, this would be the second in a 6-month period, and you would be referred to the city attorney's office for possible suspension and or revocation of your license.
I don't even know if this is 4, and the last one was, I don't know, the first one before, really.
Yep, so the first one was we pull up.
Someone broke into my place and threw a party and I got in trouble for it.
No, I think the first one was because of you not having regular operating hours.
I will read off the exact reason. So it was RPD incident, the applicant is correct. RPD incident 25-10557, which was operating after hours, refusing to let officers in which you said that someone had broken into your bar, obtained keys. It was explained during the meeting that the licensee is responsible for any alcohol violations on premises. That was issued on April 9th of this year, and it was received and filed on April 30th of this year. There was discussion at that meeting about the continuous hours of operation, and was reiterated that there needs to be continuous hours.
But that eventually wasn't what I was brought in for, correct?
Correct, so the formal expressions of concern are typically all encompassing anything that was on the licensed premise report. I believe that both were on the licensed premise report, but the first one was the more pressing issue that the committee took.
And like I said before, whoever was inside the bar when I talked to a police officer should have been arrested because no one had my authority to be in that place. And I don't know why I got dinged for it, even though when I spoke to the officers that I said, no one should be in that place. I don't understand how it's my fault.
So I will clarify that that one is already received and filed. We're not going to relitigate that issue. At this time, I will hand it off to the police department for the current issue that we are here for.
The current issue that we're here for would be bar not being open for consistent hours. And quite honestly, it's hard for the police department at this point to try to check when the bar is open, because the hours listed on the license are different than the hours that are listed on Google, which are different than the hours that are listed on Mr. Marco's website.
So it looks like,
Okay.
not that I know of, but I mean, I never created one before.
Okay, well, there is a website for 20 Grand Lux,
I didn't either. Okay.
and it does have hours listed on it, it has a menu of food provided at the restaurant, has the address listed. And officers did do a door pull there just at 4:45 today, which is within one of those listed hours. It was not open, we haven't found a single time that it has been open. We were asked on May 1st to do a compliance check, we were there, and again, it was locked and not open.
So that is the issue, is that you do not have normal operating hours. Any questions from the committee members?
Can you remind me what the ordinance states regarding that topic?
Do you have the specific ordinance going further as to?
Yes.
Operating hours and.
Yes, so the operating hours are going to be whatever is set in the application. And the consistency is whatever this committee views as appropriate. So in our ordinances, it is section 6-87, which requires a continuous operation of business. It states verbatim, no retail class small b, class big B, or class C license shall be held by any person or entity who is not actively or continuously engaged in business. Licensees must operate the business in accordance with the floor plan or plan of operation, including the days and hours of operation as submitted to the Public Safety and Licensing Committee at the time of the application. Failure to actively or continuously engage in business shall constitute abandonment of such license and shall be cause for revocation. There is no definition of what actively or continuously engaging in business is. Then it's up to this committee to determine whether any individual license is actively and continuously engaging in business.
Did that transfer to the reserve license too? 'Cause I know they had
Yes.
very strict things with the reserve.
Yes,
Okay.
I have questions.
Go ahead.
Okay, so is this the only one you own, or do you own something else like in Kenosha?
I own two other places in Kenosha.
Okay, and who's running this when you're in Kenosha? Is there, do you have an agent that's on?
No one runs the one in Racine, because we had so many problems inside the building, so now I'm purchasing the building, because the current landlord wasn't fixing anything, it would have been a safety hazard. So I'm purchasing the building, so I can get inside and fix it, and so I won't have no more issues with people actually breaking in and doing whatever they want. So I only can probably open once or twice, so I even went to the office today to try to change my hours just as Friday and Saturday, possibly Sunday, just so I can get everything more aligned and correct any issues.
Correct, he was in at, it was probably right around 4:15 today and did apply for a license premise change. So that would have to be introduced to the common council and then come back to this committee beforehand.
Are we able to defer the item until that comes back? Cause I don't wanna make a decision on this until I see the new.
We should be able to defer this item. Yes, does that mean we want to bring in Mr. Marshall again?
With the, yes, to have this when everything's all in front of us,
So
unless somebody has
yeah.
another idea.
When do you anticipate that the property will be purchased?
Probably have like maybe a month ago, we just, the current owner is under a land contract, and we're trying to figure out the stipulations of. He may or may not be behind on certain things, we're trying to figure out how to make this all work. So it's a little, we should have been closed by now, but it's a little bit more stuff that we've just learned. That's
So-
going on, so, I mean, I can open up, I just want it to be more safe for the public. So, I mean, if I open it up, I guess we really won't have anything to talk about.
So if we choose to defer this item, what kind of timeline do you think you need to get the business in order as far as the purchase of the?
Hopefully 2 to 3 weeks for that.
So I would think when not the next one, like if council kind of approve, if they do, and then. We have another 2 weeks to be good, all that stuff litigated and done with the contracted.
And I mean, we can also talk to the actual owner of the property, not the one that's under the land contract, and she can also state that we are in the process of trying to buy the building. And get everything situated, so it's not like we're not actively doing it.
So is it the owner can't fix up the building when it's under land contract?
They can't, well, the actual owner probably wouldn't do that just because there's no real value in it for her, but the guy that's buying it as the on the land contract should do it, but he's not doing it. And I'm just renting, I don't go in, first of all, I don't have the money to go replace a $30,000 roof, and it's not my building, things like that.
So I'll make a motion to defer for. What's that, 2 weeks from now?
Okay, so we have a motion in a second to defer this item for 2 committee meetings. So that would be 4 weeks from today.
Okay.
To bring,
Just a clarifying question, should both items be coming, this item as well as the
Yes.
application for the license premise
Yes.
change to the same meeting?
Yep.
Oh, yes.
Yes, any discussion on that motion? All those in favor say aye.
Aye.
Opposed? Motion passes. Okay, see you in a month.
Thank you.
Okay, you're welcome.
Good night.
Thank you. Next item, please.
Item 0621-25, a renewal request for a public dance hall for the 2025-2026 year for banquet hall Brandy's LLC, 3319 Washington Avenue, ZBA Banquet Hall Brandy's, Georgina Posada, agent.
What can you tell us about this application?
Sure, so this is a renewal for this location. I haven't seen any concerns. Renewals are not required to appear unless the committee requests their appearance.
Motion to approve.
Second.
We have a motion and second to approve the license. Any discussion? All those in favor say aye. Aye. Opposed? Motion passes. Thank you very much. Next item.
Item 0388-25, the Health Department give a presentation on the following community health improvement plan and community health assessment for the current year.
All right, would you like to look over an hour and I give you the hammer?
Please, thank you.
Got 30 minutes.
Thank you very much.
They went fancy with it.
Oh, yeah, look at that.
Anyway.
Do these folks need to get sworn in?
They do not.
Okay.
Yeah.
All right, well, good afternoon. I'm Diane Bowers, I'm the Public Health Administrator in the City of Racine. This afternoon, I have Cody Pierce, who's the Director of Community Health and also our lead epidemiologist. And I have Bobby Fergus, and Bobby's the Deputy Public Health Officer. Again, we're all obviously for the City of Racine.
Welcome and thank you for coming back again.
Yeah, appreciate it. Appreciate the opportunity. So we're here this afternoon to talk about a community health improvement plan, or as we call it, the CHIP. The CHIP is mandated through the state of Wisconsin to be completed every 5 years. The state provides a broad definition as in must do, but no parameters on how to complete. This is also an unfunded mandate through the state of Wisconsin. Every jurisdiction compiles and completes with different interactions at community level or data level and different results. Some are 1 page, other ones are 100 pages. Outside the state of Wisconsin, a lot of jurisdictions do not engage, it is not a requirement. The process depends upon budget and staffing and time. So the 2025-29 City of Racine CHIP primarily focuses on traditional public health issues identified as community priorities or mandated by state statute. For example, the prevention of sexually transmitted infections. It also addresses broad-based issues such as unaffordable or poor quality housing and homelessness. We have a stakeholder collaboration, Central Wisconsin, Aurora Healthcare Network, Racine County Public Health Division, United Way of Racine County, Wisconsin Department of Health Services. This plan is based on data from the 2024 Community Health Assessment, key informant interviews, the 23-27 State of Wisconsin Health Improvement Plan, Federal Healthy People 2023, the 2023 Racine Speaks, the 2023 County Health Rankings, and then community interactions through the Lincoln Cane Initiative. City of Racine challenges: 18% of children live in poverty, 14% of people report severe housing problems, 12% of people report having had experienced food insecurity, low childhood vaccination rates, many houses built before 1960, high rate of overdose deaths compared to the state and the country, large Medicaid base. The county health rankings and roadmaps rank Racine as 61 out of 72 Wisconsin counties, making it one of the least healthiest counties in the state of Wisconsin. In 2022, Wisconsin ranked 49th among 50 states for public health funding at $72 per person, compared to the national average of 116. The 2024 Green Book states that the county of Racine provides the lowest amount of health and human service funds than any other county in the state of Wisconsin. We have 3 focus areas. First is addressing social and community conditions leading to health disparities. First objective is to create a system of support to reduce the number of underhoused and homeless citizens. Second objective, create a city where environmental hazards are properly and equitably addressed. Again, 64% of the homes in the city of Racine were built prior to 1960, and they contain materials that are detrimental to residents.
Can I interrupt you for a question about, what do you mean by equitable? In there where you had made a statement about equitable. In that sentence.
Sure, equitable, with being equitable, that everyone has equal access and equal opportunity.
Okay, and how do we achieve that?
Through patience and hard work. Having communications with community members, figuring out exactly what the inequitability factors are. And determining those barriers, and then coming up with a plan and how we can address.
So have we done that?
Yes, we've been, within the framework of this document, we are now, developing the measurables along with the, focus groups, the strategies are all listed within the book. And, the different strategies and how we will do that.
Within the book, in this book?
Yep, community health plan.
Okay.
Yep. Focus area 2 is decrease overdoses through harm reduction. The first one is decrease the negative health consequences of the opioid substances and increase participation in the strength, access, and non-pain awareness program. Increase the number of permanent safe disposal sites and prescription drugs and controlled substances that are being second objective. In 2023, Racine County had an opioid death rate of 31.5 per 100,000, which was more than the rate of the state of Wisconsin and the rate of the United States. And then the third focus area is to reduce the transmission of sexually transmitted infections. Promote sexually transmitted infection screening as part of medical care for those aged 14 to 64. And the second objective is to decrease the rate of reportable sexual transmitted diseases and increase awareness, education, and distribution of condoms. The rates of sexually transmitted disease in the city of Racine are more than double the rate of Wisconsin alone. So these line up with what we were seeing through the Racine County Health Needs Assessment, safe and affordable housing, alcohol and drug and substance abuse, access to healthy foods, community violence and crime. So again, those line up. They also line up with the state of Wisconsin improvement plan, healthy housing, effects of interpersonal violence, violence overall, substance abuse treatment and prevention. They also line up with federal Healthy People 2023 goals, healthy and safe home environments, reduce drug and alcohol use, reduce STIs, sexually transmitted infections, promote healthy eating, nutritious food available, prevent violence and related injuries. It also lines up with Racine Speaks, with housing, poverty, crime, life expectancy, and the environment. So as we take a look at all this data and look at our focus areas, we've been interested in making sure that we met the needs of the community, we met the needs of those individuals who were involved in each one of these endeavors and gathering the data. Any questions?
Yeah, why is the fee so high on this or low on this, so depending on how you look at
Yeah.
it? For STDs and for opioids and all of that, what's unique about Racine compared to the rest of the states in the country that we would have these kind of numbers?
Yeah, well, if you take a look at the challenges within the city of Racine, again, 18% of the children live in poverty, which is a high number. 14% of the people report severe housing problems, and then we have the age of the housing. 12% are experiencing food insecurity, and we have a large Medicaid base. So with all of that, our rankings just continue to stay within that low category. We've got dozens of other different health indicators that we also see within the city. But at the same point, all of that has to do with the fact that, again, we've got high level of poverty. We've got low levels of graduation information, low levels of graduating high school and going on to a secondary employment or educational opportunities, along with all of this, these other ones that are all kind of compiled and together, let alone that the state of Wisconsin doesn't invest within the framework of health. So, if you take a look at Medicaid reimbursement rates, we're also at a lower level for that, for interventions and interactions. So
Racine or the state?
of the state of Wisconsin.
For
Yeah,
reimbursement rates.
yeah, so, and then with the county providing the lowest amount of health and human service funds, it's all is combined and settles right here.
So did you say the county provides the lease number or is provided the lease?
Lease number, the county of Racine provides the lowest amount of health and service. Health and human service funding in the state of Wisconsin.
So that would come from the county taxpayers to the city or?
Yeah, so the city's part of the county, but collectively, as the county, we still have the lowest rate that comes in from the county. So we, again, we take all of those together along with the other health statistics we have, and that's where we end up.
Any questions from committee members?
I do. You mentioned stakeholders, so we're going pretty fast, so can you repeat the name of the stakeholders and did you collaborate with each one of those individually?
Sure, yeah, so the stakeholders that, Weekend Ascension of Wisconsin, Aurora Healthcare Network, Racine County Public Health Division, United Way of Racine County, Wisconsin Department of Health Services. So the first 1, 2, 3, 4, 5 that I mentioned there, we all work together on the community health assessment.
Chris, do you mind what page is that?
That is page 3.
Which one?
So
3?
The handout or
It's the third slide. The slide.
Okay.
Third one.
third slide. So every 3 years, we come together and then produce the 2024 community health assessment. So again, every 3 years we get together. We have a document, the questionnaire that we review, that we agree upon. And then the questionnaire is distributed to the community. This process, there was 500 individuals that were asked to engage. And with that, we were responsible for the press releases and answering community questions, the posting of the QR code. This is also a telephone survey. It's an independent group that represents all of this. But there's also hard copy, there's also online that's available to complete that.
So just so I'm clear, after we found the slide, you actually met with all of these individuals, including Racine County,
On a regular basis.
to come up with this plan, to collaborate with them to create this.
For
Wow.
the community health assessment.
Okay. And then another question I have, so you probably answered this already, but I just wanted to make sure I have it written out, so I just have to ask it the way it is. So, what process did the health department conduct to engage the participants?
Sure, so within the community health assessment, again, there was 500 individuals that were engaged for the responses to the survey. We reviewed the survey, we worked together collaboratively as a group to determine if those questions were still viable, or if there needed to be alterations. The press release, QR code, answering community questions. Also, we were involved with key informant interviews. Those were particular individuals that were chosen that were leaders within the community. Very specific questions, again, were determined by the group and they were asked. And asked to be responded to. We also were involved with the town hall meetings within the Lincoln King Center. And then again, with that, we also utilized the information from the Racine Speaks. There were 300 individuals that were involved within that process. And then there were thousands of individuals, I understand, that were involved at the federal level and at the state level for their improvement plan.
Okay, thank you. And then my last question for the moment is, what priorities have been established? And what do you view the health department's role is versus the community partners to achieve these priorities?
Okay, so again, let's see. Starting on page 5, we have 3 focus areas. At the same time, each one of the community and health department is responsible along with our partners. So again, the first objective is to reduce the number of unhoused and homeless citizens. Take a look at environmental hand hazards and make sure they're properly and adequately addressed. So again, the health department, housing is part of what we do under certain circumstances, but not collectively what we do. So for example, we work with the departments, the different departments within the city, the NED, the building departments, Thomas departments and then take a look at the properties and the determinations along with any lead risk or lead assessments. At the same point with that, when we're looking at homelessness, we work with hospitality center, we work with Halo on a regular basis. We have interactions, interventions with those, the individuals that are housed there or using those services. We've also participated or we've gone to the streets and participated in providing information, interacting with those individuals that are homeless, seeing what we can do to assist through the vending machines. We have personal hygiene kits along with other items that individuals can have access to.
Okay, I'm gonna let you finish, then I have some more questions after. Unless you're done. You have a question?
You mentioned something about Lincoln King Center. Just refresh my memory, that project's fully funded, it's already paid for, right?
Yes, it's, yeah, moving along, they get the hole in the ground and, you know, wall it up or foundational wall it up and such.
There's
It's
no
not
court
paid for, it's not paid for yet.
no,
Yeah, that one I can't, it's the funding aspect that I've been involved. So that I can answer.
I was
We
just
have
curious about.
either 14 or 17 million in short-term
Yeah,
borrowing
yeah,
that may get transferred to long-term would cover the cost of that.
concerning.
This is probably way ahead of schedule, but I'm always like, cause my mind is in budget mode right now for my municipality, so. Without having my budget book in front of me, what percentage of the pie do you think that the health department out of the tax levy is using up?
I've never figured that out, so I can't answer that
All right.
question.
So have that ready for the budget time, cause I'll be asking that question again.
Okay.
Yeah.
Okay, fair enough.
And
Yeah, because it is an unfunded mandate. And so when we take a look at this process and how we do it and realizing that our operational budget has been flat for years now. We don't ask for additional funds specifically for this project. We gather this information, we have these interactions, we use existing staff. And we implement with this existing staff,
so another, because I had to go through the whole sales tax thing, and that was a very grueling and difficult process, it made us look at things in a very granular way. So one of the things that I asked, and I'm also gonna ask you for, is I'd like to see a list of what is mandated and what is not mandated. And if you're saying that there's nothing mandated, then that's fine, but just kind of a synopsis for council when it comes to the budget time. I will put that all in writing, but I would like to see, you know, the services that we're providing, like what is mandated and what's not mandated, and then really start to look at, are we collaborating truly with other people, and why aren't we collaborating more to try to come together as a whole with the county and trying to save all of our residents more money.
So I have a question.
sure.
The health department's currently housed in City Hall, correct? And there aren't any satellites that people can go to?
Not currently, no.
Okay, so how many people do you think the health department sees every day on average?
I can tell you on an annual basis. And depending upon the activity. I can't tell you on a daily basis. I've got that number back at City Hall, but I don't have it with me.
Well, I have to grow sometimes so I can divide the annual number.
Right, so it depends on. Depends on the service, like we provided 768 immunization were provided. 671 STI clients were facilitated. So our annual report, which was itemizes all the numbers and all the services here. So 11,000 kind of, so per day number, like I said, depending on what you're looking at, as far as services go.
So, looking at the challenges, I'm kind of surprised by some of this, the low childhood vaccination rates. The schools require vaccinations in order for children to attend school, whether they go to public school or go to a charter school or any other. Why would our vaccination rates be low?
The state of Wisconsin, is a little bit more lax or is lax, with their vaccination. So individuals, can just not get vaccinated, and at times they just let them through and allow them to continue to go to school. Other times they can sign a waiver, for whatever specific or, whatever particular reason, that they don't want their child vaccinated. So, so, yeah, those would be the two. We, within the framework of collaborative activities, we work with the county, we send out letters, we do telephone calls, and occasionally we do home visits to try to track individuals down. Schools refer them to whatever, is an appropriate venue for the parents to get the child vaccinated and such. But again, those, the perimeters for the vaccination for the schools aren't always enforced.
When you say vaccinations, which ones are we talking about?
So, well, there's a series of vaccines that are required for school. And then obviously there's other vaccines that kids can get that we do recommend. But the major ones are polio, measles, the MMR, which is measles, mumps, rubella, a Tdap, Tdap, which is the tetanus. Yeah, and then we have varicella for chickenpox now. There's a heap. Some ones off the top of my head that are most common, we call them our kindergarten special. So we send out letters monthly to any child that's going to be turning 2 and younger that hasn't been vaccinated, to let parents know. They let them know where they can get vaccinated, and then we do work with the schools because they have to give us a record in October every year of how many students are up to date on vaccines, how many are behind, and then how many waivers we have. So we do work with them, trying to get out there more information on vaccine hesitancy. We had a lot of that during COVID. People very hesitant to get vaccinated, so trying to work with families if they have questions, work with pediatricians, work with family practice providers throughout the community to just help families understand what vaccinations are. We're really working on trying to get that increased, but we can have people
Do you have an idea on what percentage of waivers there are for vaccine?
It really depends based on, there's, it is higher than that, yes. Because they have personal waivers, they have religious waivers. So depending upon the schools, but Racine County as a whole, we have some work to do. We wanted recently for measles, we wanted to be at that 85 to 90%, and we're right around 75. So for the city. So it's really a lot of education. That's along with a lot of this, it's working with community partners and student education. A lot of people, they have questions but they don't want to ask, or they do ask, and it's just getting the information out there and trying to reach the population.
Is there a population that is difficult to reach out to? As far as especially vaccinating children?
I wouldn't necessarily say one particular population. I know that we kind of depends on the vaccine, I'll be honest. Like some of our vaccines are more working with the Hispanic population to get them to get vaccinated. It just varies. It's based on school. A lot of our elementary schools have lower vaccination rates because those are the kids coming in, or by middle school, we can get them caught up. And we'll always welcome families by the health department, encourage families to, we want all of their kids to have well child visits, so we encourage them to go to providers, but we are a resource.
Don't most children have a pediatrician where the pediatricians also keep track of their vaccinations?
Some do, some don't. Some people move often, or they have records from other states that we try to get, so that we can make a complete record for the state.
Yeah, and the city of Racine is a medical and dental professional shortage area. So that's why it's so important to get forward health in here. And being able to have an opportunity for additional professionals, medical and dental, to be able to provide the services, because we are a shortage area.
Well, aren't three of our unified schools providing the services? For dental health and medical?
Now,
For James School, for example, not James.
now they have nurses who come in, so if you're talking about the school nurses.
No, I was talking about unified has built facilities in three of the schools. Including Julian Thomas,
Yeah, for the mental health.
for the mental health, dental and medical.
Yeah, they have an outside vendor that does dental and they do the seal smile. They don't actually do fillings or cavities or extractions and such within the framework of the school.
I don't have any more questions, anybody?
I do, could you share these on PDF with the council?
They have been shared. So
Oh, I didn't get that.
initially, the complete document was sent out in February for a draft of it for consideration. So it was in February and then it was sent out.
Can you resend both of these documents to us,
Yes,
please?
glad to.
Any other questions?
Yeah, we'll send the annual report out again as well. That's us.
That's these things too.
No, that will be separate, they sent that out in May.
Yeah, I think we sent it.
I don't remember receiving that, so if you could resend all of that, to us,
Sure.
please.
Yeah, pretty glad to.
Well, I thank you that we finally got to get this presentation.
Yeah,
Yeah.
appreciate it. Okay, all right, if there's any other questions, feel free to send us an email or give us a phone call. Have any discussion.
All right, will do. And
All right.
All right, thank
Great,
you.
Thank you.
I think this is a receive and file.
Mostly receiving file.
Second.
In a second, receive and file, any discussion? All those in favor say aye.
Aye.
Opposed? Motion passes. Thank you again.
Yeah, thank you. Have a good night.
Have a good night. Hope you get to baseball. All right, next item, please.
Item 0624 25. City of Racine Police Department for the licensed premises renewal.
All right, we will hear from Sergeant Auckland on this mighty fine report we had.
So very short report between June 7th and June 20th. There's two items I want to read. If they're very minor, and the second one is actually not in your agenda. I sent two. But this one did not get attached, so I will just read that in its entirety. First one on June 9th, we went out to Michelle's where there was a disorderly conduct, two parties were fighting. It did close down the bar, but it seemed to be a really minor event, I didn't really want anything done, and it was a single punch just between two people. And then the second would be Kayla's Bar, which has been on the radar lately, there was a fight, the bartender called in. Patrons were leaving on arrival, there was no issues with it at all, so just those two events.
What did they put in the alcohol at Kayla's crying out loud? They're always fighting over there.
It's a little running.
So were there any concerns from the committee?
I'm just flabbergasted so short.
I don't know if we can do this, but I would almost like it as part of the licensed premise report. If we could get an update on 3700 Northwestern Avenue, which is not a licensed premise for alcohol, but it is a licensed premise, that's the hotel.
So I have seen before where the committee has asked for an update at the following meeting on a license, even if it does not have a liquor license. So I believe that would be in order unless the attorney's office, seeing it being a new representative from them, has any concerns.
No, I would just ask that it be a separate agenda item from the licensed premise report.
Okay.
But there could be a update on that location.
Okay,
Is that the travel log?
that's the travel lodge, yeah, and
I was recently in there and they told me I did not check it because their bar was closed. They did tell me that they did have some form of liquor license. But it was closed at the time that I went, but they did have a large response there, I think within the last week.
yeah, that's really why I brought it up, it's because I've gotten calls from the neighbors about fighting in the parking lot and. And I don't know if that's one of the parking lots that people are just conversing on.
So they had a special event that night. I responded out there personally, there was a special event, it was a graduation party, but it was. People that had come up from Waukegan, which is a trend that we're seeing recently, there was somebody there that brandished a firearm after a couple fights occurred, so we went in and cleared everything out. And then the owner did state to me that I wanted to make sure this was not gonna be a recurring issue. They stated they were gonna shut down all graduation parties and baby showers for the rest of the year and not hold any of those until after summer is over.
Why would somebody come up here for a graduation party from Waukegan?
We have seen a trend recently, where a lot of students come up from Waukegan in. It's basically a caravan of 100 cars and they go from park to park. Recently, there was a post at the beach. Where there was a lot of kids that went over and took over the parking lot and police have to respond and. Basically move them from area to area and issue citations where possible, but it's taken up a lot of our resources at the moment.
I'm so glad Illinois chose us.
Man. It's considered and called online street takeovers. And Illinois cracked down pretty hard, so then they started coming up here.
Okay. Well, I don't, can we get a report on that? Yeah. Should we, or is it something that we should be discussing in our PSL meetings? I kind of think it should because it is a public safety issue. But it's not related to a license, so I don't know if we need a separate agenda line item.
If the committee would like, they can make a recommendation to call in the travel lodge to discuss, and I can just create a new item to go through the process.
It may be a bit premature,
Okay.
it is a very recent trend we've seen.
Okay,
And it's just now picking up traction within our department, so I know that our deputy chief is aware.
okay,
And we have been in contacts with the city attorney's office about different options that we have, in
Okay.
regards to parks and the legalities about closing them early, things like that.
So did this stem from the travel lodge? I thought it was from a B&B in Caledonia.
So that night was a different night, so that
Oh.
also started at an Airbnb in Caledonia and came down, and then they went to the park. And then they went to, the Citgo on Washington Avenue. And then also, we've been having issues, while this report is light, we've been having issues with Tino's across the street from Select 627.
okay,
But that has been this crowd, it has not been Select 627, which is why it is not in the report, so. I've been able to kind of separate those and we have been doing your attention, keeping them out of the Tino's lot and moving them along. But unfortunately, when you have a crowd of 100 people, you have to have at least 10 officers, you need to have your team. And the officers who are writing the citations, but also the officers that are providing security to those officers.
I would like a separate line item for some of these massive issues, so we can at least try to talk about them when they come up and you can report on them, so. However, that has to be,
well, I think a
Done.
communication will have to go through the council, so I'd ask the clerk's office to put a communication in from the committee requesting to have an update from the police department regarding public safety issues unrelated to the licensed premise report.
Surely, I can do that, and I'm sorry, because I might have given a wrong answer before. We can either formally do an item, or if the committee wishes, you can also informally ask the police officer to report on it. We could like a formal item to go through.
Yeah, I think I would, see,
Okay.
I had to put in a formal request, have discussion about.
No, I gotta take care of.
So, yeah,
I'm taking.
and, yeah, I don't mind going through council, that's fine.
Will do.
Okay, alrighty, any action needed to be taken on the,
especially to approve.
motion approved the report? And there's no one we want to call in as a result of this report, so we have a motion, a second to approve the report. Any discussion? If all in favor, say aye.
Aye.
Opposed, you have to pass it. Almost the final item.
Item 0625-25, requesting any consideration in form or expression of concern or other action pursuant to the police report.
Appears we have none. So motion to receive and file,
Motion to receive and file.
Second.
motion second to receive and file, any discussion? All those in favor say aye.
Aye.
Opposed, motion passes, and I think we need to go back to. We win zoo, DBA, lucky we win zoo.
You want me to read the item again?
Yes, I do.
Okay, all right, item 0620/25, and massage establishment of application for Win-Win Zoo DBA Lucky Win Zoo Therapy located at 906 8th Street, Win-Win Zoo agent. First district.
Okay, now this is the first time this has appeared on our agenda. What do we typically do? Kara?
Right, so it's been a while, I believe typically you give them one more chance historically, although it's been a long time since I've done one. Jeez.
Well, I would like us to do that just so I can get the clerk's office, read this item again.
And what we should do for the next PSNO meeting,
We have.
You're
Motion,
deferring?
to differ.
Oh, okay,
unless we-
second.
a motion, in a second to defer this item, just for my pleasure. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion passes. We are at the conclusion of our agenda and we are adjourned. Bam, bam. Thank you all for your patience tonight. Not too bad, a little over an hour.
No.
Hold on, not mics.